Very excited about our patient presentations. We selected as a committee patients from the CASSS community that are contributing actively to developing new therapies for patients globally. So they will tell their own stories in their own words, and please do find the time to talk to them and just really admire them all, and especially admire them for their courage in coming to speak up and sharing their stories. So first up, we will have Kathy Lee. She's a CMC regulatory professional with a lot of experience and is also currently shaping the future with her work on ICH M4Q-R2. Next, we have Mike Sheahan, who is more involved on the financial side, but has advised in his role at Danforth Health more than 90 plus early biotech companies. So that's a different perspective again, but really admire his story too, and hope you enjoy it. He's also got some interesting hobbies, such as playing drums in a dad rock band, and something about Australorp chickens, which you'll have to ask him about since I don't know much about chicken species. And then finally, last but not least, we have Mike Abernathy from Amgen, who's leading Amgen's internal digital innovation, as well as the end-to-end regulatory content automation efforts. He's been speaking out a lot as a patient experience, so it's always fascinating for me to hear his story.
I assure you this is not related to my disease. Okay, here we are. It's a pleasure to be in front of you today. I really did a lot of thinking, just trying to put together some slides and some talking points today. And it made me realize the severity of the disease, multiple myeloma. When I was initially diagnosed, I started reading statistics. The doctors told me not to read the statistics. And I said, but I'm smart. I know when these statistics made. I look at the dates of the reports. It was still a mistake for me to look at the data. Why don't we just start with what is multiple myeloma? So multiple myeloma is a cancer of plasma cells. I don't have to say a type of white blood cell to this community that normally produces antibodies. Often no symptoms are noticed upon the initial diagnosis. That was the case with me. There are absolutely no symptoms. As the disease progresses, certain symptoms start to arise, such as bone damage, lytic lesions, which I have some, but they're insignificant, so they decided not to repair them. Anemia, I'm still anemic. Renal failure, and other types of infections that occur. In my history with multiple myeloma since 2020, I've been hospitalized at least 3 times for severe sinus infections, and I believe that that's because of the multiple myeloma. My body just can't respond well enough to get all that stuff out of my system, or I'm not sure if it's because my body can't do it, or do I get admitted to the hospital because I am a myeloma patient and they want to make sure that I'm going to be okay. I don't have an answer on that yet. So a few more stats on multiple myeloma, the things that I never wanted to face back in 2020. The disease is treatable, but it is incurable. In 2020, globally, 175,000 individuals were diagnosed with the disease, and 117,000 people died from the disease that year. And more stats, just based on data from people diagnosed with the disease in the United States between 2015 and 2021, about 62% of those diagnosed live 5 years or more post-diagnosis. Without getting into all these details here on my diagnosis, I have the multiple myeloma affects my IgA, and I'm considered a high-risk patient because of cytogenetics and a TP53 deletion, which I'm still trying to figure out what the hell that is. So this is kind of a timeline. I'm going to try and get through this pretty quickly because it's a long timeline, but it's basically the first year. So it takes us from diagnosis to where we are today. I know that's more than a year, but the first year, 2021, was significant. And in 2020, we all know what happened around March 2020. I don't have to explain that. the logistics and the communication between the medical professions and their patients is typically good. I'm a patient at Mass General Hospital, which I feel is one of the greatest hospitals, facilities that anyone can go to in this country. I'll go there for a stub toe if I have to. So back to my diagnosis. So I was diagnosed in March of 2020. And how I was diagnosed was I went in for my annual physical. They took a blood test. They noticed that there was something going on with my whites. Of course, they didn't tell me that. My primary suggested that I come back in for a second blood test where they actually did an SPEP, where they, without getting into too much detail, because I certainly don't know all the details, but they get a better look at what's going on with your immune systems. And they're able to pinpoint that I had an elevated IgA. So a typical normal IgA, the range is 69 to 309 mgs to DL. I believe that's micrograms to deciliters. Yeah, okay. Thank you. Mine was 3,870, so slightly above the highest unacceptable limit. So I think the normal protocol would be is that my primary was supposed to call me back and suggest that I seek help or seek a consultation with Mass General Cancer. It didn't happen that way. It happened a little bit of a weird way. So we have the patient gateway. I'm sure you all have portals where you can log in. You can see your test results, your appointments, request more medication. I got an email. New test results have arrived. Oh boy, the test results from the second blood test. I had seen the results and I saw the words such as abnormality. And they were reviewed by an oncologist. So I had a pretty good feeling I was about to be diagnosed with cancer once the oncology department called me. So I went upstairs and told my wife. I said, I think I have cancer. And I said, but let's not panic. Let's wait. And so then the cancer department called me. We set up an appointment and I went in. They did a bone marrow biopsy right there. And the first one's always the hardest. And it's a weird procedure. That's where they get the actual details as to what's going on in your blood. They take tissue out, they take bone samples. They're able to count cells. So it was at that appointment that I was diagnosed by Dr. Rob of being a multiple myeloma patient. I was multiple myeloma. And as he went over various treatment plans, chemotherapy, of course, first came up. But he wrote down very slowly, but there's this really cool thing happening down the road. It's called CAR-T. It's in the clinics now. He said, this can be happening very soon. Hang tight. So I did, but I also went on my chemotherapy regimen. Began the first cycle. So August 25th, my birthday. Woo! I was working on an IPO for small pharma. I've been in small pharma for, 25, 30 years, and I love it. I love scientists. I love sitting at the table having lunch without you all. So much more interesting than finance people. So I went out. I was working on an IPO for one small pharma. I made all the changes to the registration statement, got it out to the larger working group, the attorneys, the bankers, the auditors. And I said, I need to blow off some steam, so I went for a mountain bike ride. Hopped on my bike outside of my house, ran some trails, had a hell of a mountain bike crash, turned my left leg inside at the knee. So it was a dislocation. Spent the night in Mass General again, this time not as a cancer patient. But this leads me to this is a pivotal point. And I'll say right now, I paid for getting into immunotherapy with a badly damaged knee. I had to go off chemotherapy at that point because I couldn't heal. I needed surgery. We had to put the knee back together. Came off of chemotherapy, had the surgery done September 30th. And then as you can see, September 30th was the surgery, November 20th, elevated IgA, November 30th. Wow, I'm enrolled in a clinic. I was eligible to be enrolled in a clinical trial. How did that happen? I relapsed. And I looked at it, I was like, am I coming through a relapse in the back door here? It didn't seem right because there were so many other patients ahead of me that were probably waiting for this treatment. And here, a clown crashed my mountain bike, and I'm eligible. So we went through all the tests. I tested in, and I got in. January 11th, because I was off chemo, you can see the IgA numbers back up to 4097. Really big, really big. I was infused with BB2121. Interestingly enough, way back in the day, it was Bluebird Bio that was working on that immunotherapy. I was part of their IPO team. I should have saw that coming. So marching ahead, I spent a month in the hospital. I went into the hospital very sick. I don't have much time to talk about that. So I spent about 24, 26 days in the hospital at Mass General, amazing facility, caring healthcare professionals, asking me if I wanted ice cream at night because I was still very healthy. I was probably as healthy as I am right now, looking at me. So then February 17, 2021, my IgA is back down, down to 346 after the infusion of BB2121. Currently, BB2121 is a commercialized product under the branded name Abecma, a BCMA. BCMA is the protein that appears on myeloma cells that my natural T cells cannot detect, which is why I had cancer. I could go on and on. It was a really wild ride. So for this is like, how am I going to pull this all together? What does this mean to me? Well, there are so many rings, and there are so many groups of people with different specialties, but we're all human beings. We're all in this planet. We are here to help each other. We are here to support one another. Family, friends, medical professions, scientists, even finance people like myself help people every now and again. At the middle of my community here is multiple myeloma. Patients, me, coworkers, research scientists that live in my town. Pam and Peter worked on BB2121. I go fishing with Pam's husband, and Peter has a son that is at my son's Taekwondo studio. We see each other at the studio. We see each other at the Kicknick, the annual Kicknick. Research scientists overlap with medical providers through clinical trials and myeloma. My medical providers, my shout-outs are Andrew, Rob, Jill. There's a whole group of people that I would love to continue to thank for them. The interesting point here that I'm trying to make is that when you're going for care, long-term care, I'm under care, I'll be under care for the rest of my life until there's a cure, but I am so happy with the progress that has been made on immunotherapies and CAR-T. I can't thank anybody enough if you even know about it, but thank you. Additionally, what I want to say is that the doctors, the medical profession, they are where the rubber hits the road. They're getting the high fives from the patients and the families. Not all the time, but when it goes well, they get the high fives. The science community, I don't know if you get all of that all the time, but thank you so much. Continue doing what you're doing. The economy isn't so fantastic right now related to the funding of your companies, your programs. Let's wait it out. Let's wait it out. The tides will turn, we'll get out of the weeds, and we'll be able to lift other people's lives back up again. Thank you so much for your time. It's been a pleasure.
Okay, so Michael, Kathy, you have to be brave to come up here, so let's give them another round of applause, please. Wow. All right, my message to you is patients matter, but you matter, and together we matter. I'm going to show you through this how all of this all came together to something that I think will make a difference. But let me start here. So this is myself and Craig, right? And that's Craig's number 3. I'm the guy that's when I had hair. But Craig's story is remarkable, so I'm going to start with his story. And Craig was my childhood friend, so childhood that we played wiffle ball when we were in diapers together. We went to the same school. We played sports together, quarterback, receiver, point guard, shooting guard, shortstop, second base. We were connected, right? Always connected. And those two kids, little did they know they had genetic anomalies. And Craig Ended up being one of my best men at my wedding. He actually signed my marriage certificate. Craig married a wonderful woman named Alyssa. They had 4 children. And then the world stopped in 2015. Craig was diagnosed with stage 4 pancreatic cancer. And you as scientists, me working in this industry, we know that's a death sentence, right? But when you get that information, you can't share that that's a death sentence. You have to have hope, right? And Craig, we grew up in a rural community. We didn't have access to a lot of things. It was fortunate that we were still very close, and he reached out for help. And we did everything that we could possibly do to help him. Initially, he was misdiagnosed with adenocarcinoma. If you know anything about adenocarcinoma, very aggressive, that's an immediate death sentence. And having his charts and being able to touch base or tap into the scientific community, the scientist said, you know what, have him re-diagnosed. So we sent him to San Francisco. He was re-diagnosed. Turned out it was neuroendocrine tumor. Now we have a little bit better chance, right? And I watched him take FOLFIRINOX. And if you don't know about FOLFIRINOX, it's a massive dose of chemo. And I almost watched him die with the treatment FOLFIRINOX. But once we identified what the tumor was, we had a little bit of a fighting chance. And we lost Craig September 23rd, 2024, right? But in 9 years, we never lost hope. His kids, 4 kids, his wife, the community, nobody lost hope. And the real message here is the remarkable story behind Craig is he's an inspiration and motivation for innovation. And that's what we do because there are life-threatening diseases, there are uncurable cancers that we need to treat. The people in this room make a difference, you matter, and we need to find cures to help treat diseases like pancreatic cancer, right? So his story is much more remarkable than mine. Mine's actually kind of ordinary, but it was nonetheless a surprise. It's funny, Kathy worked on the project Stacey worked on the project that's helping him. It turns out I worked on the project that's helping me. I helped register this project back in 2015. And my journey started, I was commuting back and forth between New England and California in the process of relocating, and I had to be in California every other week. This is back when we had to actually be in the office all the time. And I was in the Philadelphia airport, and I sat down in a chair, and little did I know I passed out. And the lady next to me grabbed me and said, "Hey, baby, you okay?" And I said, yeah, I'm fine. I'm fine. I thought I was tired, right? I thought I was just tired. Commuting back and forth is exhausting. And so I wrote it off. I'm just tired. And then after moving, I remember sleeping. I could hear my heartbeat in my head. It just kept beating and beating and beating. I'm like, why is this happening all the time? And then sleeping, my hands would go numb. It would tingle. And so my wife finally said, hey, go to the doctor. Typical male, not going to go to the doctor, but we go to the doctor. And so they do all the blood tests. We do extensive blood tests, and it comes back, cholesterol is really, really high, right? And my story is about patient access. Because my cholesterol came back well over 200. And that should have been a sign right there. But the doctor said, okay, let's work on our diet. Let's work on some exercise. Let's see what we can do to improve our health. I'm a pretty healthy guy. So I spent a year losing 10 pounds, working out consistently, controlling my diet, to a point where I come in the next year and have an opportunity to run the same blood test, and it turns out that my cholesterol went up again. And so at that point, having worked on this treatment, I knew what was going on. I had a genetic anomaly. It turns out that I was a heterozygous genetic anomaly, so just a perfect patient for this treatment, Repatha. And if you don't know about Repatha, it's for familial hypercholesterolemia is one of its target patient. And just to explain that a little bit, you have low-density lipoprotein, receptors on your liver, and if you have this disease, you don't make as many of those. So think of those as like fishing nets, right? And then you have PCSK9. Think of that as someone just walking around with scissors, snipping that net. So I can't ever catch the bad cholesterol, all right? So I'm deficient in the LDL receptor. And so when it gets snipped, then I'm even more deficient. And so what this treatment does is it comes and it grabs a hold of that person with those scissors and it takes them out of the game. So now I keep my receptors and now I can clear cholesterol. I had a recent doctor's appointment. My cholesterol was under 30, right? Under 30, so truly remarkable therapy. Again, something that I worked on and had no clue that I was going to end up taking it. All right, so that's my somewhat ordinary story. Let's see if we could get to the next one here. So if you've probably, some of you may have seen this slide before. The slide content is not important, right? The message behind this slide is what's important. And what this is saying is we have to do better when it comes to speed, when it comes to getting product to patients faster, right? And the other message behind this is we all can make a difference. I created an iteration of this image shortly after Craig was diagnosed with pancreatic cancer because I wanted to do something to help patients, something that I could actually have some control over. And if you have any idea about our regulatory system can be a little bit archaic. It can be a little bit slow. And in the interesting world that we live in, the intersection of technology and science, everything is going faster. Genetic discovery, clinical trials. And what's going to happen is we're going to get to the regulatory piece of what we do. Everything's going to stop, slow down, and get to a snail's pace. And so my idea was we have to do better here. We have to do better here. So I had an opportunity like you all do to make a difference, right? And there's no hidden motive. There's no hidden agenda. There's no politics behind this. This is purely me trying to help patients by doing something that I can control to get them product faster, right? I'll finish with this. And I talk about speed. You talk about small cell lung cancer. And we just had our executive officers and directors meeting. And we had a patient come in and say, hey, the timing was just right. I was diagnosed this month, and 6 months later, a treatment came out for this. And I was on the treatment, and it cured me. And it was a fantastic story. But the thing is my son's best friend's grandmother had the same disease, except she had it a little bit earlier. And she's no longer with us. But if we had a regulatory system that moved faster, she might still be here, right? She might still be here. So as we move forward, I have high anxiety because the speed by which everything is moving is wild, right? And I don't want to be in a place where everything's moving fast and then I slow it down and I cause a delay in getting product to patients. But at the same time, I'm excited because I have the opportunity, like all of you do, to make a difference in the lives of patients, right? And then I think we have to have the courage to make change, right? And I'm just going to share with you what, we want to do better in the regulatory system, and we have these 21st century technologies. But what we do is we still lean on laws, regulation, guidances that are human-made and were made 20 to 30 years ago when these technologies didn't exist. We have to do better, right? So have courage to make change. And then finally, have confidence, right? Have confidence that you can make a difference because it matters for people like Kathy and like Michael and myself, right? And there's so many more patients out there that need us to come through in developing these innovative medicines. So I'm humbly here to say thank you and encourage all of you to make a difference. Thank you.
Thank you to all three of our patients, Kathy, Mike, and Mike, for their truly inspiring stories. I hope you all take the energy and the motivation that they've put out there and go deliver your portion of this this great work that we all do and deliver for patients. So we now have a 15-minute transition time before the session starts. So enjoy the day, be fantastic, and it's great to be here. Thank you.